Hey, what's up guys? Ryan Ford here, bringing you another demon drill. Today we're going to talk about why you should stop being a newbie and start training barefoot.
And I'm Dr. Kenneth Cow at Vital Balance Chiropractic. I'm also a trainer at Apex Movement. I see a lot of dresseurs as patients, and a lot of them are hurting themselves because of improper footwear. So I wanted to talk a little bit about some of the basic structures of the foot, just so everyone's on the same page. You got basically 4 muscles that comprise the ankle stability muscles. So the pronatus longus and brevis does the downwards and lateral motion of the foot. So it stabilizes against forces coming in this way. This is commonly the inversion sprain is what we usually see. So in other words, this muscle protects against inversion. The tibialis anterior brings the foot upwards and across the body inwards. So that's this big strong muscle. It's mainly there to protect for the heel strike, to help lower the foot down, so it's not as commonly injured as the other ones. Posterior tibialis muscle starts from the inside of the shin right here, goes to the bottom foot right here, and it protects from, or it contracts in a downwards and inwards motion, just like that. So any force coming in from this side of the body. In addition to barefoot training, a lot of times we need to stabilize the ankle using just exercises. Typically is pointing the toes down and going sideways. If you're interested in learning more about strengthening the ankle, which I do highly recommend, there's a video called Titanium Ankles, which is linked over here. What you can do is just look up that video, start exercising, start training that in addition to your barefoot training.
So I've trained with a lot of shoes over the past 8 years of doing parkour, and only recently, in the past 6 months, did I start training barefoot. What about some of these shoes is harming your feet?
Well, the first thing is that if you know anything about physics, you'll know that a longer lever arm is going to apply more force around the joint. In other words, right here we have a buildup of maybe 2 inches roughly. So this on top of the bottom of your foot is going to increase the distance from the joint to the ground, which means that as soon as you begin, let's say, rolling your ankle, maybe you have bad landing, maybe you're a little bit off center, that's going to apply that much force. It's almost going to double the amount of force around the joint that normally would be there, making you more prone to sprains.
So as opposed to like this shoe here, which doesn't lift your heel up.
Absolutely. This is pretty much the bottom of your foot right here. They put it as close to the ground as possible.
So you're saying that you would probably sprain your ankle less?
A lot less, yes.
Or it would be less severe?
Exactly. So one of the big problems with shoes is that it's basically a big cast. It's basically a rigid frame around our entire foot, which means that from, the first time that we're learning to walk, as toddlers, we're required to put on shoes on our kids, or it's like child abuse or something. What that means is that we're casting our foot, and if you've ever had a cast on a broken arm, you'll notice that all the muscles atrophy, and it doesn't take long for that to happen. So we grow up, we end up having this problem all the way into our adult age, and what that means is our foot is not conditioned. It doesn't have the stability, it doesn't have the strength, it doesn't have the natural shape that it should if we hadn't put it inside this rigid frame. The arch right here, the medial arch, is the most commonly marketed arch. What most people don't know is that there's actually 3 arches. There's a medial arch, there's a lateral arch, and there's a transverse arch. All 3 of those need to be intact for a good foot. If you build up the medial arch on one side too much, then it actually collapses the lateral arch. What that means is that you've created an ankle problem.
So traditional running shoes are kind of promoting this problem?
Yeah, traditional running shoes are making this problem much worse than it needs to. So because of our development, we have a fallen arch on this side, which is what everyone talks about. You get a lot of pain on the medial side because of that fallen arch. When we're wearing shoes, the arch is built up, and now we're rotating here, this bone, in this direction, so that when we land, we're landing in the incorrect position of the talus, which means that you end up jamming this joint. So many dresseurs that I know have this injury.
I've done that several times on precision jumps.
It's that pain where it feels like you can't bend your ankle anymore, and it's a hard end feeling. It's just like it hurts if you bend your ankle that far. The talus is this bone, the first bone that articulates with the tibia, right here. So a lot of times someone will walk in with tenderness right through here, or a jam joint there, or they may have tenderness on the outside of the foot in these 3 spots. On occasion, I do see pain on the talus from the posterior, but that's pretty rare. Those points of tenderness can very well mean that you've got unresolved sprains or strains in your ankle, and so you're vulnerable to injury, which means that starting those titanium ankle exercises may be a really good idea right now, maybe even before you get too much into the barefoot training. A lot of dresseurs deal with knee pain. In my clinic, I have to deal with that a lot, and the first thing I usually look at is the foot. See, the foot is extremely flexible. The foot can move in all these ranges of motion. It's got all these joints, all these bones meant to adapt to the environment.
It's the most complex joint in the body, right?
Exactly. The knee, on the other hand, is pretty much two bones that meet right in the middle and bend only in one direction. There's a little bit of rotation, but mostly it bends in one direction. Which means that if the foot is not moving, if the foot is not adapting to the environment, the first place that's going to feel it is the knee, which is less adaptable. So it wears out, and so you get a whole bunch of problems in the knee and eventually into the back and the spine because of the foot problem.
So runner's knee, jumper's knee, all that kind of stuff.
Yep, meniscus damage, a lot of wearing away there. A lot of these problems are actually insidious. They kind of creep up on us. A lot of people don't know that they're having knee damage because they can't even feel it, but over time it's been wearing away, and over time it's been getting worse and worse because of a foot problem.
If you start training barefoot and you progress to that level where you're doing it all the time, do you think that's going to help your biomechanics to prevent these injuries?
Absolutely, absolutely. It'll make a huge difference on a lot of those pains that people are dealing with.
Can you think of any like famous free runners or people that have been training barefoot and show these proper biomechanics possibly because of it?
I know Phil Doyle is one.
Yeah, I think I saw a video, it's like 5 years old, of Phil Doyle like striding across bars and literally doing everything barefoot, and it appears to be just as easy as if you were wearing shoes. Also, I've noticed a couple of Russian videos are completely barefoot, even doing like big drops and rail precisions and things like that. And then just around here locally, I've seen Jake Smith. He's been training barefoot, I think, a little bit longer than any of us, and his foot's actually starting to look like a native caveman foot. Also, I've seen him do huge jumps and precisions and things with those barefoot shoes, and he's just become so much more confident with them, and his biomechanics are improving, and he's probably saving his body in the long run. One of the interesting things I learned at the Vivo Barefoot Cert is that over time your foot conforms to your shoe. So you see people that have these like crunched up toes and they start to shape their foot however the shoes that they usually wear. Whereas if you compare this with like little kids or like a native barefoot islander type of person in a third world country, you'll see that their foot is very flat and spread out with lots of space, especially between their big toe. And as you guys start training barefoot more often, you can see this foot, it's a little wider, it's got more space, and it's actually recommended you have a whole thumb of space in the front of your shoe so that your foot can flex and move around like it should when you land and when you run and jump. So as you guys start training barefoot more often, your foot is actually, over a period of a year or two, going to start to flatten out. It's going to start to spread out a little bit back to that original form of how it used to be.
It's kind of like a minor version of Chinese foot binding. You know, this is like we're binding our feet in a certain form, and so it ends up becoming that form rather than just letting it naturally do its thing. How do you choose a good shoe? A few things you want to look at is, first, like we just mentioned, you want a wide space for your toes to fit inside the shoe. You don't want these narrow shoes, especially women deal with this a lot of times when they're wearing high heels. These pointed tips. What the pointed tips do is they end up bending all the toes in and creating a problem in the future where they start developing bunions on either side. The joints are now malformed and they have to have surgery to deal with it. The other thing you want to look for in a shoe is, obviously, you want to keep this very sensitive, which means thin material. You want the thinnest material you can from your foot to the ground, which means that you'll be able to sense more. The other thing is you want a very flexible shoe. One thing you'll notice about the Vivo Barefoots, which is fantastic, is that you can basically roll them up in a ball. Real small, real comfortable, which means that they will be more responsive to the environment around it, more like your foot.